Ian, is, Ian has taken part in 2 GIST clinical trials at Memorial Sloan Kettering and has traveled to Europe for integrative treatment options in his journey to be cancer-free. Ian is a great example of someone who has tirelessly advocated for himself to receive the best possible outcomes. Margaret McIntyre is a loving wife, mother, grandmother, and great-grandmother who has worked for over 50 years in education. After being diagnosed with GIST in 2019, Margaret connected with the Life Raft group and is grateful to have been matched with a wonderful mentor who has helped her navigate her disease journey to ensure that the highest quality of care has been given to her. She benefited so much from her mentor, she decided to pay it forward to becoming a mentor to others. Being diagnosed with GIST forced her to slow down, care for herself, and pay attention to the important things in life. Jean Arian is a married couple. Her and her husband, Gary, ironically, have been throughout their GIST journey. Jean and Gary have advocated for themselves and each other, gaining valuable advocacy experience. We are so lucky to have a great group of speakers today to share the importance of the topic. First, I would like each panelist to give a brief background of their journey with GIST and why they think advocating for themselves in their journey was so important. Jean, I would like to start with you. So make sure you unmute. You're still muted, Jean. There you go. Oh, you're still muted. Okay, instead, let's start with Margaret. Go ahead, Margaret.
Okay, well, good morning, everyone. I'll make this brief, although our journeys with GIST are not brief. But my story is 4.5 years ago, I went to the doctor for a totally unrelated issue, and because I had a really good doctor who wanted to run some tests, they discovered I had GIST and sent me immediately to my state medical center, and they totally diagnosed the GIST and recommended surgery immediately. I mean, the surgeon said to me, if you were my mom, I would do it tomorrow. And my husband and I decided we wanted a second opinion, went to Mayo in Rochester, saw a surgeon who said the same thing. I want to do surgery right away. And the oncologist agreed. He was not a GIST specialist, by the way, and they knew my diagnosis going in for my second opinion. But he agreed because they couldn't get enough tissue to do mutational testing. He said, listen, Gleevec doesn't work that long anyway. Just go ahead and have the surgery. And something just didn't ring true with me. I had contacted Life Raft, had read enough that I knew about Gleevec, and I asked if I could maybe try that before surgery, and reluctantly the oncologist said yes. And there's more to my journey, but basically I had to advocate to myself for myself to even be put on Gleevec. And so it's been a long journey. I've had I'm on my 4th oncologist. I had 2 really good ones and only changed to my last one because of geography. But it's been a journey, and I'm going to tell you, without Life Raft, without my mentor that Sandy talked about, and without, I guess, the information I get on Gist Chat from other Gisters, I don't think I'd be here today. And so I'm so much in favor of self-advocacy. I think it saved my life.
Thank you, Margaret. Okay, Jean, it's your turn. You're still muted, Jean.
Better?
Yes. Well, now it's saying you're muted again.
Is that better?
Yes.
Good. I was diagnosed in 2020. I think it was about September. And I was having pain and just felt really, I was short of breath. I was working, trying to go up and down steps like I always did. And so I talked to my primary care doctor, and she said, let's get a CAT scan. And they called within a half hour and said, I have a large mass on top of my stomach. And they sent me on to a surgeon, a general surgeon. And at this point, I had never heard of GIST. And you know, my thought was, I just want that taken out of there. And unfortunately, in the surgery, my tumor ruptured. So, but they got it all out with clear margarine. But in hindsight, in my case, I think I should have had the testing first, or had a biopsy, had the testing first, and had taken imatinib. Once, you know, they found out I was exon 11, to shrink my tumor or mass, because I worry about it rupturing. And so that was my start with GIST. And then last October, well, in September, I kept saying to my husband, you look, you know, your abdomen looks swollen, distended. I said, how are you feeling? And he would always just say, oh, that's because I don't do crunches anymore. And I said, well, you haven't done crunches in 10 years. And so he said, I just, you know, I'm feeling sluggish. And the only way I can explain it is I feel like I'm full of air. So he went to his primary care doctor. He no sooner got home. Well, no, they sent him for, I think it was an ultrasound. And then on the way home, he had a call from her and said, we want you to head back to the hospital and get a CAT scan. And his CAT scan showed very large mass on the stomach, and also numerous masses in the liver. And so at that point, and his CAT scan said probable GIST, possible something else. I can't pronounce it, but I researched it. And so at that point, we thought, you know, we hope this is GIST, because it seemed like the better of the two, believe it or not. And I called University of Colorado in Aurora, and we got him an appointment with the sarcoma clinic, and someone we knew was a GIST specialist. So they did his biopsy and found that he was exon 18. Wait, I got all these numbers written down in my pocket. Exon 18 PDGFRA D842V. And so that's Gary's mutation. So that's our story.
Thank you, Jean. Ian, if you'd like, you can speak.
Hey everyone. So I guess my journey today has been 7 years now. I kind of similarly felt breathless after going to the gym, checked myself into the ER. They did some tests, sent me home. Next day told me to go back because I guess I was bleeding internally for 2 weeks and my hemoglobin levels were really low. Ended up going for CAT scans, spent maybe like 12 days in the ICU. They found the mass, they removed it. And then following that, I started going to Sloan Kettering. At that point of time, I was given the option to either go on imatinib or try a clinical trial. looking at the statistics for people on imatinib, I kind of saw that, maybe 10-15% of people will be, it'll work for them for years to come. And so I decided to take the clinical trial instead, because I thought that my chances might be better then. Over the years, I guess I was on that trial for 2 years, had progression, had a couple of different liver procedures from embolization to most recently Y90. And now I am currently on another clinical trial that I started this year, which is a combination therapy of Sutent and the CGT. And so far it's been good. I've had 2 consecutive stable scans. And in between, I think as the introduction mentioned, I have kind of tried to look around to see what else is available out there, both within the US and outside of the US. I think for most of us, because we are so US centric, that we don't often think about looking outside, but there are also options that could work outside of the US. And so, even though I'm stable on this trial right now, for the past 9 months, I'm kind of reaching the median before people start showing resistance and things like that. So I'm always on the lookout for what's next.
Thank you, Ian. The next question I would like to ask my participants: what are some steps to take when you don't feel that you are receiving the highest quality of care? And I will start with Ian first.
Yeah, so I think to answer this question, I will give a recent-ish example from last year. So I go to Sloan Kettering, which is, one of the top places to see for GIST. And they have a very good sarcoma team there. I really like my oncologist, Dr. Chi, who's very evidence-based. And so I think most recently, when in order to deal with some of the liver progression, they offered me a couple different local procedures, being either bland embolization or chemoembolization. And based on my research, I guess I just kind of wanted to see what other options were out there. And so I did some research online. I had got like a second opinion, and I came across, the fact that there is actually another liver procedure known as Y90 that is potentially more effective, and it's very often used in Europe. And so I guess against my oncologist's advice, I did the Y90 procedure at Mount Sinai in New York City. And whenever I look back, I think that's like the right decision, because, it's worked very, very well for me, at least, as it has for many other patients. I am exon 11 primary, 17 secondary. So I think, if you think about whatever is being recommended to you, at the end of the day, oncologists might be specialists, but you have the most skin in the game, right? For them, as much as they do want to help you, it is their job, whereas for you, it is your life. So I would always kind of like be a bit more skeptical, sometimes too skeptical, and annoy my oncologist, but I think at the end of the day, it's worth it.
Thank you, Ian. Margaret, it's your turn.
Okay, Sandy, that's my story too. I love everything Ian said. I went to 2 oncologists. The first one admitted he didn't know much about GIST and only had one suggestion, and that was Whipple surgery. The second one turned out not to be a GIST specialist, even though he was at Mayo. They didn't put me with a GIST specialist, and I had to change. I knew I wasn't getting from everything that I had read, and I just advocate for everyone to read everything you can, research everything you can. I just knew there were other things out there that my oncologists weren't telling me about, and maybe they didn't know about it. And so I had to advocate for myself. I I think that being introduced to Life Raft and talking to the people there, they helped me know where to look and who to talk to. And Santy, I had a wonderful conversation with you and my mentor Kay that led me to. But this was during COVID, where I couldn't leave my house, or I didn't think I could, and you helped me become a patient of Dr. Trent in Miami virtually. And so he helped me through the pandemic, seeing me every 3 months. But he was very respectful of me as a patient, and gave me options and talked about what I wanted, where I saw myself as a patient. He was very respectful of my need to advocate for myself. And so I think research, find specialists, find a GIST specialist, number one, maybe do the research, get up to date on medical terms. My first two oncologists talked about things I had no idea what they were talking about, and that was my fault. I needed to do the research, and so those were the steps I took, and I don't regret it one bit. I feel like if I had taken the advice of the first two surgeons, I don't think I would still be here.
Thank you, Margaret. Jean, it's your turn.
Yeah. Well, anything in our life, I just research like crazy, to get really educated. With just for a while, it kind of consumed me though. I was doing it so much. I think it's just so important to always try to be one step ahead. And I don't know if I done that for trying to feel like I'm in control of this rotten disease or what, but I think it's always good just to get as educated as possible. I'd like to learn more about procedures for the liver, since Gary is my biggest worry right now, and he would like to know of some more procedures, what could be done with masses in the liver. So we just started with new doctoring at Holden Cancer Center in Iowa City, and we're pleased with this doctor, and we're going to have a lot more questions for him.
Thank you, Jean. My next question for the panelists, I would like to ask, what were some challenges you faced in advocating for yourself, and how did you combat these challenges? And I'll start with Margaret.
Well, when you have two surgeons say, we want you to have this surgery immediately, it's really hard. I think we put doctors, and respectfully so, on a pedestal. They know a lot more than I know. I know that, but it just didn't seem right to me at the time. I needed time to do my job, which was to do the research, to read about it, to talk to other people that had the same issue. It's intimidating. I mean, one of the surgeons, talk about play on your emotions. He said, if you were my mother, we would do this surgery tomorrow. Well, you not only did I feel like I shouldn't question you, I felt guilty. I mean, he pulled the mom card on me, and so it's difficult, I think, to advocate for yourself. But I just knew that I needed more information before I could make that decision. And so, thank goodness, I found Life Raft experts that knew about it. I read everything I could. I mean, it's I think when I switched to the mindset that those doctors were my partner rather than above me, but they were partnering with me in my journey, and ultimately it was my life. And once I really came to that conclusion, I think it changed everything in my medical journey.
Thank you, Margaret. Jean, I'll pass it to you.
I wish, in hindsight, I wish in my case I would have slowed down. To get the diagnosis was crushing, and I just wanted a quick solution. I wish I would have asked for a second opinion. I guess not knowing it was cancer yet or that it was malignant, my thought was just, oh, I hope they take it out and biopsy and it's benign. I just wish I would have got a second opinion and went slower. Somehow got a biopsy first, and then because I think the imatinib would have been successful to shrink my mass down before surgery, because it's working for me now.
Thank
Yeah.
you. Ian, it's your turn.
Yeah, so I think for me, I shared a little bit about, some of the challenges I faced when advocating for myself in terms of when I disagree with my oncologist. But also I think for me, my go-to strategy is to just gather as much data as I can and using that to make the best possible decision. And so whether that be from different sources, obviously the patient groups are a big one, just because it's filled with a lot of people and conversations that you can search, whether it's a listserv or Facebook groups about people who have traveled before you. So I generally see that as like a sense of like, okay, if I take this path, there's a chance that I will have the same result that they did, right? Obviously everyone is different, but that's kind of like the overlining assumption. And then after that, trying to gather more data on, what other clinical trials out there, and just trying to really rely on your own research, but also the research of others who have gone before you. The LifeRef group was a very big part of that for me in the very beginning, especially, even just their website and kind of like downloading into my brain all that information about what is just like what are the clinical trials available, and all that information. So if I were to do anything different, I probably would not do anything different if I was faced with the same issue today.
Thank you, Ian. I would like to now give the panelists an opportunity to share a piece of advice to someone newly diagnosed with GIST. And I'll start with Jean.
I think one of my first calls for support was to the LifeRaft group. And it was very comforting. I spoke with Tony and asked her a lot of questions. And I guess I somehow felt relieved, there was other people who understood this, because it sounded like such of a rare cancer. And yeah, I think that's where I got my first support, and I really appreciate that.
Thank you, Jean. Ian, what advice would you give?
I think the three most important things to me is, obviously find a GIST specialist. When you first get in, especially if you're not lucky enough to be having access to a specialist right away, like in a big city that I did, just looking at the LifeRef Group website, for example, there's a whole list of doctors that you can kind of find and use. And then the second thing is to get mutational testing, because based on that, it really changes potentially the course of your treatment. And then lastly is really trying to approach any recommendations from doctors or, family or any well-wishers who feel like they want to help and may not necessarily be the best person to do it, but approach all that inputs with like a critical mind. Because at the end of the day, you have the most skin in the game, as I mentioned earlier, right? It's your life. Sometimes people do or do not want to do something because they don't want to hurt feelings of people close to them. But at the end of the day, yeah, you kind of have to weigh the pros and cons. If you really feel strongly about something, you should just pursue that direction.
Thank you, Ian. Margaret, what advice would you give someone?
I don't think anything original. If you don't know about Life Raft, you've got to get on the phone, call them, or contact them online. That would be my first recommendation. Secondly, find a GIST specialist. I think many of us spend a lot of time with really well-meaning, really well-respected oncologists who don't know about our disease. And so finding a GIST specialist is absolutely a necessity. And then the third thing is research, read, find every bit of information you can about this disease, because you have to make life-altering decisions and you need all the data and all the facts that you can get. And when Ian talked about family, I have to tell you a personal story. My husband is a retired veterinarian, and we don't know if dogs have GIST. We have no idea. I don't think there's been any research, but he was really sure that I wouldn't have to have Whipple surgery. He said, if you were a dog, I could go in and take that tumor out. And I wasn't amused by that first. But secondly, he's so well-meaning and he loves me probably more than anyone in the world, but I couldn't take his advice either, as funny as it was. So you just have to advocate for yourself.
Thank you, Margaret.
And dogs do get GIST, believe it or not.
Do they?
Yep, there's imatinib for pets. I believe
Oh,
at some point of time that was cheaper than getting imatinib for humans, so I
Yes.
considered it.
Yes, I forgot about that story. Yeah.
Oh, yeah, I would be interested in that research, because I have a really, talking to my husband would be much easier if I had the research. So thank you. Share that with me.
Well, thank you, everyone, for questions and answers to the questions. Let's take some questions from the audience or comments the audience may have that participants will gladly answer any questions.
So people can raise their hands through that feature on Zoom. You could type it in the chat, or you could just unmute yourself. We want this to be interactive. I guess I'll get started. I'm curious if folks on the line have had trouble advocating for themselves with insurance, because sometimes the insurance system likes to really do a number on us in terms of getting coverage. So I'm at least familiar with Ian in terms of him navigating some insurance hurdles. And I thought maybe you could just share some of the tips that you've done that helped you along the way with getting some insurance coverage for testing and otherwise.
Yeah, sure. So I think if you look at insurance, for at some point of time, people have insurance provided by your company, or you have Medicaid or Medicare. For me, for a large part of the time, it was provided by my company, so it was pretty good and well-rounded. But I did have this one bump in the road, mainly when I was trying to get Quinlock, the drug. Basically, I had gone from imatinib to Stavaga. I had skipped Sutin, so the insurance approved, not needing Sutin, because in theory, my mutation did not necessitate that I needed it. And so when I progressed on Stavaga and going on to Quinlock, my insurance basically denied my coverage for that for 2 or 3 or 4 months. And so that was extremely frustrating for me. At the end of the day, I ended up having to get on Sutin for a month, showing that there was no effect before getting the drug for Quinlock. Sorry, getting the Quinlock drug. And I think for me, like, I had really exhausted all possibilities. I even considered buying it off the shelf for 1 or 2 months until it was going to be covered. I ended up having to do the Sutin thing. And yeah, I guess in some situations, it's not always going to go your way. but there are ways that you can potentially try to get around it. In terms of like actual insurance coverage, like looking for the right plan and all that, a lot of states actually have, at least for New York State, they have like a free insurance if you're low income or whatever. That's something that you can explore. But yeah.
Thank you, Ian. And I just want to say that we do frequently hear where, like Ian's situation is a perfect example. He was secondary mutation exon 17. Suitin doesn't work with that, but the insurance was forcing him to do that. So we've heard this before. And so, contact the LifeRef group. We can provide data and evidence to help with that appeal process, because it's just unfortunate if they're forcing you to take a drug that does not target the mutation that you may have. You may not know how to navigate that, but we can help assist you along the way.
Sarah, do you have anything else to add?
No, I think this is great. I mean, if people can't think of questions today and they want to email us or connect us with the others on the call, we're happy to do so.
I have one last quick thing actually. So one thing that's really helped me is just making sure that I have all my data, my reports, my medical stuff, everything organized, that I can quickly share with doctors. I'm gonna post a link in the chat of how I've organized kind of like my journey, but it doesn't have to be super elaborate. It can just be even like if you open up like your Google or your Apple Notes and just really write out, every time you have like a major milestone in your journey, to just add it there. But yeah, that's been super helpful. It makes it a lot easier for doctors to quickly review everything, and it increases the chance that you would get a response right away or as soon as possible.
Yes, what Ian does is tremendous, and he just posted the link. That's actually also another reason why I thought of him for this panel. He documents his whole history and what he's taken and his research. And not everybody can do that with the technology, but joining the patient registry is going to be tremendously helpful, not just to help contribute to research, but it also helps you track. If you can't do that yourself, we provide a gistory, which is a summary report of people's histories, often as they can share updates, which we encourage people to share their updates often with us. But Ian's really teaching us about how to research and document, because when you switch between different providers, sometimes they don't have all that paperwork, and it really helps to have that all together so that, they're prepared in terms of, what's the next step in terms of the clinical management of the disease. So really great advice there.
And I'll just say, I'm not the techie that Ian is. I wish I were, but I've got mine organized in a file folder, color-coded by which doctors I've been to, copies of every single report I've ever gotten. I'm in the patient registry, so I can look at my summary there, but I think it's really important that you keep your own records and not depend on your physician's office to do that. I mean, obviously they have it too, but going between doctors, that's been one of the most important things that I've done. So you can do it kind of the old-fashioned way too. I have a beautiful portfolio of pertinent information. So.
I use the portal with the clinic we go to, because that has everything right there.
You should pay attention to the notes that they write in that portal, because you may need to go and, ask them to edit things if they didn't get things correct. So it's, be on top of that as well. Because I think that one of the other participants who said she was her husband was exon 9. I mean, sometimes they mix up scans, the doctors. They don't, somebody said about the bone mets that were missed. It's like unfortunate, because I know it's exhausting to just navigate your care or your loved one's care. But, the doctors are human too, and their staff, and there are things that get missed. So being on top of that can really help catch those things.
Thank you, Sarah. Appreciate it. Thank you all so much for joining us today. And thank you to our fantastic panelists for sharing their wisdom. The Life Raft Group understands that when faced with a rare cancer, getting the best chance at survival and high quality of life requires more than just following directions from your care team. Just patients and caregivers alike must continuously advocate for the highest possible care based on the latest research, as Ian has said, and insights. Please always remember that you are not alone, and the Life Raft Group, including the GIST mentorship program, is here to help. And if anyone would like to inquire about how to become a GIST mentor, both as a patient mentor or a caregiver mentor, please let the Life Raft Group know that, and they will forward your information to me, and I will be glad to get in touch with you and to talk to you further about it. Thank you, everyone, for attending today.